Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help.
My current setup is, so they're right there doing their thing. We got TV up here. That's 6th Street, that's Main Street right there. And so, this is literally my golf simulator. And we're making do, right? This is a 2020 pandemic, right?
I love the good parent advice of if he starts beating on you, just don't scream. That's the most important.
He's not going to hurt you that bad.
Yeah, he's got a little fist. It can't hurt that bad.
Right. Guys, all right. Lucy, what do you need to say? You need to be quiet. Ryan, you need to stay off. No. Oh, yeah, I got to open a Lunchable for her real quick. I'm sorry. Okay, I think we're good. Let's see how that goes.
Brad, like so many of the rest of us, is at home with kids. So you may hear
in my shop with kids, but it's essentially my home right now.
Yeah, it's where if we go to work, we're taking kids with us a lot of time just because they're all out of school or homeschooling. So I really appreciate you taking time. I know you're really busy doing some amazing stuff there. I was just talking on the phone with a close friend of mine, Dr. Carl Seeger, and he called me to tell me that so we're having a summit this weekend. It's a 3-day summit, some really great physicians and epidemiologists talking all about COVID. And he was going to be joining us for the summit, but he can't because he's just completely overwhelmed. And for those of you who heard our podcast with Dr. Hillary Seeger, that's the Smarter Dr. Seeger, the Pregnancy and COVID podcast. But Carl is a great guy. And he told me that he was the medical director for something called the Asante Team MacGyver. So Carl is a ER physician, and we started telling me about what you all were doing. It was fascinating, and I just wanted to learn more and more. And he told me that I should really talk to you, that you're the guy. So, Brad, you are the lead coordinator for COVID SKUNKWORKS. People can find information at covidskunkworks.com. You have a degree in mechanical engineering. You're a small business owner. But during these times when our businesses aren't really doing much, what I love is that you have not just stopped working. You've taken all that knowledge and energy and expertise and applied it towards solving some big problems. So can you just start off by telling me what you guys are doing there in Southern Oregon?
Sure. Yeah. There'll be a little bit of distraction because my kids are over there currently smiling at me as my son is sitting on my daughter, but we'll get through it. Everybody's dealing with this right now. So right now what we're doing is I saw that there were a lot of really cool things happening around the world. There were people, 13-year-olds printing N95 masks in their basement and, people trying to do these face shield things. And just there were so many people wanting to help. But the problem with that was they didn't have the logistical know-how to have it actually work in a clinical setting. And then there were a lot of more challenging things that needed a true clinical experimental setup with doctors, scientists, engineers, makers to actually really tackle some of the meat and get it tested very quickly. What happened was back on Sunday, literally last Sunday, I don't even know how many days ago, but just a week and a half ago, I contacted the local hospital and said, hey, I'm an engineer. Can I help with ventilators? Like, I know you guys need ventilator manifolds, I guess. And the director of supply chain came back and said, within 2 hours, said that, we actually could use some help. And can you kind of build a team maybe? Within 24 hours after that call, we had 35 experts on the phone learning from Asante what the problem was. And we started organizing. And so by that Tuesday, we had face shield prototypes being delivered to the hospital.
That's incredible. So tell me, so you mentioned face shields, but then you were talking about ventilator manifolds. What are you doing with ventilators exactly right now?
So yeah, I mean, we're working on just about everything right now on ventilators. So there's a lot of talk about ventilator manifolds, and and again, we're working with a lot of different, the actual experts on this, and they were sending us pictures of just, a bunch of Y splits and just splitting it off to different people, and no control over pressure. You would essentially just have have it be a pressure control rather than volume control, and just hope that it's good enough for everybody, that you're not blowing people out. What we have done, and we're experimenting today in the hospital in the clinical setting, is we have created a system, 3D printed with integrated ball valves, and then also a measurement system. So on each outlet, we believe you'll be able to measure the in centimeters of water, what is the pressure at each person in real time, with a system using wires and a 9-volt battery and a speaker that you can set a max pressure. And once that pressure gets hit, it creates a beep. So that's what we're working
Wow.
on, is not just splitting, but actually allowing the doctor and nurse to do some real clinical work on each individual patient and have a bit more fine tuning.
Yeah, and for those of you who may not completely understand why that's so important, so two things that I heard there that were really impressive to me. Number one, we know there's ventilator issues in New York City. They're basically out of ventilators, and this isn't necessarily going to be like we need to increase our ventilators by 10% or 20%. It's a multiple that we're potentially going to need. So when we can split, and I heard Carl mention something about splitting up to 6 people on a ventilator or something
Up
crazy
to
like that.
10, it comes down to the mass flow rate potential of each individual device. Ours, each person might need 500 cc's, and it can handle, 200 or 2000 cc's. And so then you just, you split that up, and maybe it could be 4, maybe another one can handle 3000 cc's, maybe one can handle more. So the nice thing about our design is it's fully scalable. In it, you can just cap it. So if you have a 6-port manifold, but you're only working on 2 people because you can only fit 2 people in that room, then you just cap the other 4 and you just have 2 people on it.
And the other really cool thing I heard about that, not just solving the ventilator number problem, is when you're in an ICU, the pressure really matters is going into the lungs. So if you can't control the pressure and every patient is getting the same amount of pressure, that's an issue. With these patients, specifically with COVID, one of the things we're finding is their lungs are very compliant, but it's very easy to damage their lungs. So you really have to watch the pressure. So that is another really big issue that you're solving there and splitting these. Is this something
Yeah,
that if someone is in a hospital, is all the information, everything you're talking about, is it all online where hospitals could go and potentially use these solutions?
Yeah, so that's again what we're creating. We are making sure that we are vetting the solution and proving it before we just push it to the world, because there's a lot of that going on right now. What we are trying to do is make sure that our solutions actually work and are, viable, and have the proper documentation so that it can go all the way from making it properly all the way up to actual implementation. And then how do you create the system so that you can measure and you can actually fully control what we're looking to do and what we think is going to work. And again, I was on the phone with a respiratory therapist at 9:45 last night, and he was cursing. He was so excited about this plan. But being able to dial in, we would set the maximum pressure for a system at, say 35 centimeters of water. And then what you would do is you would just dial everybody else down, so that you would have 35 as the max, but then you would dial each person down to 25, 20, 18, and you would just, again, be able to see that visually happening using essentially a surgical tubing off of a nipple, and then have it bend down, have a amount of water in there, and then you would just mark your zero pressure, and then 5, 10, 15, 20, 25, 30 centimeters up, and then you would just be able to watch the water move. That's the experiment that we're running today. Again, it's not fully vetted yet, but we have a high confidence level that we're going to figure something out that's going to be a lot better than just a straight splitter.
So for physicians out there, that's one of the questions they're going to have is how you are proving this and kind of documenting this, because obviously you're not doing randomized controlled trials and trying to get FDA approval and all that. You just want to make sure it's safe. So is that process that you are going through, that rigor, is that explained on the website?
Yeah, and I'll explain it more here. The website we've built over the last couple of days, I've done all the copy for that. We have a team working on the website as well. But again, we started this entire thing last Sunday. So we're expanding quickly. As far as how that process works is, it's engineers and doctors working very closely together. We have a single doctor is in charge of each group. So each section that we're working on, like Dr. Ghosh, we are working directly on that, Dr. Ghosh is kind of leading the team for the ventilators. And then, Carl Seeger, he's over everything. And so they are kind of working directly with a single engineer who is the engineer lead and working on designs where the engineer comes up with a design. And then we have a team of people that, we just want redundancy so that one printer going down can't kill us, take 24 hours out of the schedule. So we have teams that will all print the same thing, and then we'll find the best one. We will get it delivered to the hospital because we have a distribution team for that as well. And then it will get straight to the doctor. They'll be able to plug it in, test it. We get, on Zoom or Skype, and we can see exactly what's happening and see how it works and what's actually happening. And then we can make the modifications. And so, the double blind, placebo, all that stuff, like that's really good for the medical world where you're giving people drugs and doing interventions that way. Most of what we're doing is very much a mechanical, physical manifestation where you can measure, did virus get through this, or is this working and creating the right pressures? That's what we're doing. So,
yeah. And you have great. Hey, buddy. And you have a degree in mechanical engineering, so this is not something that you're just tinkering with. What kind of business did you have before?
Well, so right out of high school, I got picked up by a guy, my mentor. He was a PhD from MIT in material science, and I spent roughly 10 years designing military equipment to survive nuclear blasts. I program in like 7 different languages, do finite element analysis, pretty much every type of engineering possible. I know enough to talk about it, but there's, I'm jack of all trades, master of none kind of thing. I know a little bit about everything. And so then I started a golf company. So I make custom golf putters for, making crazy, exciting, we use exotic materials to make just the craziest putters out there. And it's me and one employee. And so it's fun, but it's surprisingly apocalypse proof. People still want to buy putters from me, but I just completely shut that down. And this is way more important. So I've started a lot of different organizations. I've been in Rotary for a long time. Ran all sorts of charity things there. Ran a lot of we created this group called the Idea Distillery a couple years ago, where it was a bunch of, again, experts helping people in business. And so I'm pulling from a lot of experiences in this. It's not something that is, I have a weird set of skills that just work for a pandemic. Hey, buddy, Ryan, you can't run up here. Go that way, please. Sorry.
Hey, Brad,
everybody's working from home, right?
Yeah, it's not a problem. It's totally fine. So don't worry about it at all. Tell me so you said engineers, physicians. Are there any types of people that you need more of? Like you just talked about the website going up a couple days ago. How could people help with this? Are there any specific things that you need?
Yeah. So we have 250 experts on the team working on the R&D. We have just about everybody we need. But here's the most important thing that people really need to understand is what we are doing is we are creating this technical documentation so that you can recreate what we've done without needing to do any of the research in your own area. So don't send us There's no GoFundMe for what we're doing. We're all, small, relatively wealthy small business owners that are just trying to save the world. There's no GoFundMe. Don't send us donations. What you need to do is go to COVIDSkunkWorks.com to figure out how to start your team. And there's no fee. There's no, this isn't a money-making thing for us at all in the slightest. Here's some water. This is just, we're trying to help people help themselves. And so if you're a doctor, most people on here will probably be doctors. What you need to do is go to your supply chain director and say, hey, Joe or Sandy or whatever, how are we doing on PPE? What are our needs? And then what you need to do is go to the local university or the local makerspace, and you need to contact them and say, hey, can you assemble a team of makers that have 3D printers and CO2 lasers and seamstresses and sewing machines? Can you assemble that kind of team? And then you need to go to, and these are all online, so you don't have to remember this, but just go to COVIDSkunkWorks.com and then start your team. There's all the instructions. And then you need a distribution manager who would be, maybe a Meals on Wheels coordinator or someone that's used to coordinating pickups and deliveries. Because what you need to have is people printing face shields and printing masks and printing, whatever else around the area, manifolds, you name it. And then they can focus on printing and making sure that's going well. And then you've got a team of people going to pick it up. And then they also are making sure that, I see a lot of stories of, I printed this thing and I take it to the hospital and I go into the ER and, hey, will you use this? Well, the ER is, that's the most virus-laden place in the whole city. And so what we do is, and again, what we encourage people to do is make sure that you are, you've got the distribution channel, because what has to happen is it goes to a sanitization area first, not sterilization, just sanitization. And we have all those methods where we have, the doctors, the PhDs working on those sanitization methods, that we have the methods to prove it. Again, we're all in Southern Oregon. People think we're just a retirement facility, but it's actually very high tech here. And so we've got some people that do some, thin film technology that are able to do the sanitization. And then once it's been sanitized, we bag it. And then the majority of it goes to the hospital. But now we're also working on that distribution channel that pulls from the community now can go back out to the community, so that the pharmacists, the dentists, the people running tests and, doing all that, anybody that needs equipment, we are going to, within the next week, everybody that needs a face shield is going to have a face shield. We're literally printing 1,600 of these things a day using an injection molder. The Rogue Valley is going to be very well covered in PPE, and what we want to make sure, and so that's just a guarantee. We've got this covered. We've solved it locally, but we've created the documentation and the exact instructions that any community can do this themselves without having to do any of the research that we've done.
What are the few kind of coolest projects that you're working on right now, just to kind of spark some ideas for people who, as they're thinking about assembling their team?
Yeah, so I'll just kind of run through all the different projects, and it's everything from the really fancy, manifolds to like an adopt a neighbor program where, these people check on these people and you build that community aspect. So you make sure that people are staying healthy. They know how to interact safely so that they're not, they're wearing their fabric masks. They're doing, following proper protocols. Then we've got, the face shields. So that's a big one where we have an injection molded design that can be printed literally 1,600 of these a day, just bam, 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 bam. And then we use transparencies and a few other things, but using transparencies, we've created a jig that you can just drill the 4 holes that you need, 500, 600 sheets at a time. And then you can just, each person put those on. We have the sanitization methods for how to sanitize those properly prior to initial use. We have, and then the elastic bands, we have the instructions for how to make that elastic band. That's all taken care of. Next up, the hand sanitizer. We have, we're making that locally, sourcing the ethanol, figuring out how to do the mixing. That's another one that we're making locally and figuring that out as well. HEPA filters.
We have a bourbon distillery here in Kentucky that we've gotten the alcohol from and made just a large amount of hand sanitizers. That's one that if you're in an area that has some distilleries, which I know you all have a fair amount there as well, that's something that's really important.
Absolutely. HEPA filters, another one just kind of across the board, especially along lines. How do you have a true 0.3 micron HEPA filter? And how can you use existing things that aren't necessarily medical grade, but how can you prove them, make sure that they're good? And then how can we create housings that are either 3D printed or injection molded? I want to talk the difference between 3D printing and injection molding is 3D printed. There's a couple different ways. One is a method where it just kind of prints in a big line and just keeps going around and around and around, and it builds up slowly. And then another one is a single layer additive method where it makes one layer, it uses UV and cures a medium, and then it just goes all the way up and it builds something. And so then there's injection molding. So both of those methods are relatively slow, but they're really fast, kind of like they're opposite of a virus. So they're really fast on a slow scale, but they're really slow on a big scale. Whereas injection molding is kind of like a virus. It's slow to start, but then once you've got the mold made, we're literally printing 1,600 of these things a day, the actual band part. And so that's where finding those injection molding companies in your local area are very important, because we have all the instructions for how to make the mold. Once you just copy that mold design, someone mills it out and then gets it to the injection molder, they can literally be printing, as long as you have an injection mold company near you, which you probably do. They're usually in just a random looking warehouse building, but they exist everywhere. You will be printing at least 1,000 face shields a day. And then you get the transparencies. You can be drilling 500 at a time, just put them, drill at 500. And then for the elastic band, seamstress says there's really relatively easy ways to do that.
Brad, what about masks? Are you all doing anything with masks? Yesterday, we released a podcast where we felt like the public really should be wearing them. I just saw Los Angeles came out and asked people to wear them. I do think the CDC actually is going to follow very soon and make that recommendation, but there's not enough. That's the problem. If everyone started wearing medical masks, we already don't have enough for the frontline providers.
Right. And so, yes, that's another one that we've done. And there's a few different aspects to that. So there's the true surgical level that what we've done there is we are essentially contracting with the best sewers in the valley that will all funnel through one organization. They will, on a piecework basis, make these masks that are, for the hospital themselves to wear. And we're, working on hundreds of thousands of those because we'll be able to handle with roughly 8 people working, semi full time, with how these are literally, it takes less than a minute to make each one, just because it's very simple. I listened to your podcast a couple of days ago talking about the folded style. We've got all the experts making sure it's the best model, but it's very simple and easy to use. So that is what we're going to be providing to the hospital. But then we have a Facebook group locally that is making the fabric ones, and that's for yourself and your family and your neighbors. And so the fabric ones that are just sewn and easy, it's really hard. Again, it's the scale thing, right? Like that's what kills us on a pandemic, is how quickly things get crazy, but it's really slow to start. With like making fabric face masks just at home, one person might be able to make 10 to 20 total before they just get really tired of doing it. But that's great, because if 1 out of 20 people do that in their area and just give it to their neighbors, now everybody's got it. And it took a couple days to do that, if that, right? So that's what we're encouraging, is for the fabric face masks, have the community make them and share them with each other, again, using safe practices to transfer and then wash every day and all that. But then for the actual hospital use, we have, and again, we're sharing this with the world, we have the plans in place so that you can have seamstresses, again, with roughly less than 10 seamstresses on a piece basis. It takes them 1 minute to do it, as long as you have the right materials. You can meet the need of a relatively large area.
Brad, you cut out for just a second, but if I understood you right, you said the actual instructions for people to make their own homemade masks are on your site?
Yes, and as we are making them even better, we just keep updating that. So we just keep making sure that it gets better and better as we go. We've also got intubation boxes. So, as a respiratory therapist is putting in, the breathing tube, we've got different styles of boxes that you can either put, there's PVC style ones, there's clear acrylic ones. We're actively working through that. We tested that prototype in the clinical setting yesterday. The doctors loved it. We're going to make a few minor changes, but that design is going live very shortly. We've got N95 masks. For N95 masks, it's a little bit different. What we have found is that we feel a lot more comfortable, just because, again, it's right there. And it's I did tell my kids to be quiet. So we are more under the impression that if you can get N95 or KN95, something like that is an N95 mask, but then sanitize it. We have methods using UVC, and again, we're looking at building shipping containers for these things, and this is how to do it. You would be able to sanitize up to 7 times or so at N95. So rather than trying to make something and seal and 3D print and all that, just make an N95. That seems a little bit that makes us feel a little bit safer. But then we're also looking at PAPRs. So we want to be able to just take, right now we're working with some hospitals in Portland that are pretty much out of the face shield portion of a PAPR. So, you've got the hood, you've got the transparency essentially, and then you've got this kind of more fabric material underneath. And it's that transparency and fabric part that they just don't have. And so what we are doing, and there's lasers getting cut right now, we're delivering to the hospital to try. We're working on, using a laser cut, we can make that exact pattern. And then for the material underneath, we've got some things that I think are going to work that probably already exist in a hospital. And then we would either use from Joann's, you can get like silhouette material to laser that out. That is, double-sided sticky, or you can just take simple 3M double-sided sticky tape, run it along, tape it to it, and then you're good to go.
And from what I understood talking to Carl earlier, you are going to take a shipping container, put UV lights all inside of it, and then be able to disinfect a large number of N95s at a time. Is that right?
Yes, exactly. That is what we're looking at. We've got shipping containers on the way. We got kids melting down because my son ate my daughter's cookie. So, she's now very upset about that. It's life, man. So we're looking at doing we're looking at doing the shipping container methods, and then different type, like what type of shipping container works best with that. We're figuring that out right now.
And Brad, I think I'm probably stressing you out with this with the kids. So
No, not at all. She'll come and sit on my lap. She'll be fine.
Yeah, the bonus guests are great. So as we were talking, I'm going to point people towards the website because it sounds like all the information is there. But as you were talking, I was just thinking about how in the United States we have this issue right now in a situation where we have a massive shortage of certain resources. But at the same time, I feel like we have a massive excess of an even more important resource, which is people like you and ingenuity and know-how. And if we're able to point that excess while people are hunkering down and are out of work, I just have so much more confidence we're going to solve the problem just talking to people like you. So how are you holding up? We've got the kids at home, you got all these projects going. How are you doing personally?
Personally, I mean, in full honesty, it's nice because, getting to spend time with the kids. I mean, they're, cute as can be. And I mean, I'm the only person in this entire 2,000 square foot building. On one hand, I'm having the most fun I've had in a while because I get to solve a lot of really cool engineering problems with the smartest people in the world. I went from, arguing with people on Facebook who think this isn't happening to working with Carl Seeger, who's a genius. Maybe not as smart as his wife, but he's still a genius. And so I'm having fun in that respect. But at the same time, anybody that can read a logarithmic chart has known how bad this is for weeks. And I've spent my fair share of time crying in the shower. Just, that scene with Good Will Hunting where he's saying like, it's not your fault. And so I've taken on this job, I'm not paid anything, but I've taken on this responsibility of doing my best to help people have PPE who are on the front lines. And so I was trying my hardest early on, starting, early this month, saying, please stay home, having people ridicule me for that and just not listen. And so it's hard to not feel like partly responsible for, not doing more to help, or, the Schindler's List, the last scene in Schindler's List, where he's saying, if I only sold this car, I could have saved more people. If I only done this. For me, it's time. And so, if only I would have stayed up another hour and gotten this thing, then that person would have had the ventilator manifold before they passed away. It's a very difficult time for me in terms of just the emotion of it all, because there's the highest of highs, the lowest of lows. There's this crazy pandemic going on in the world, trying to keep my kids, fully educated on it, but then, aware of the situation, but not make them neurotic. It's this complete juxtaposition of worlds right now. And then my wife's a nurse as well. And so what's really exciting is because of the effort that we've done, most nurses aren't wearing masks around like the country right now, just because there's so few of them. Every nurse in the hospital, I'm friends with, a bunch of them, and they all send me pictures of, hey, here's masks. It's the surgical ones. It's the nice ones, because we've secured the supply chain for everything else. So now they're able to be wearing masks, and my wife is at least more protected than she was a week ago.
Yeah, you and I were talking before we started recording about how we feel like we're in a really interesting period where the actions we take now are going to be magnified so many times. It's going to have such a big impact in the near future. So we really appreciate what you're doing. Dr. Seeger is one of my closest friends. Carl's a great guy.
Getting to work with doctors who are on the front lines. Again, people like to thank us for what we're doing. And yes, but all we're doing is, it's a war. And the way I look at it is the true front lines are obviously the doctors and the nurses. And what's happening right now is so many of them are getting sent out there without the Kevlar. They just don't have it. And so if they get shot once, they're gone. We're making sure that before they go out to the front lines, we're the supply chain. We're making sure that they've got everything they need. They've got their Kevlar. They've got their guns. They've got that. No, a war is over in 3 days without the logistics and supply chain, right? And so we are just making sure that the true front lines have what they need to do the real work.
Well, being on the front line, Brad, I honestly feel safer knowing that people like you have my back and are out there. So we really appreciate it. You're definitely an inspiration. I want to point everybody to the COVIDSKUNKWORKS.com. Get involved, be like Brad, and make a difference. Thanks so much, Brad, for joining us.
Thank you so much for having me. This was a true honor and pleasure. And let's save the world, man.
Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at WildHealthMD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.